Welcome to Pindar Poetry. We hope you learned something new.
You begin with essentials. Make sure you have a medkit plus bandages and a tourniquet equipped. Move to the casualty and open the medical interaction menu while facing them. This gives you options like assess, apply tourniquet, or start CPR. Once done assessing, prioritize stopping major bleeding with a tourniquet or pressure bandage. Bleeding kills fast, so act first. Make sure to keep cover and shout commands for help if in contact. Then prepare to use the medkit and downstream treatments. Now you stabilize. Once bleeding is controlled, apply morphine to reduce pain and improve breathing if the casualty is conscious. If the unit is unconscious, check airway and breathing. Start CPR or chest compressions via the med menu when needed. Use the medkit to pack deep wounds or begin an Roman 4/ blood transfusion to correct hypovolemia, which prevents shock. Make sure to communicate the patient's state to your team and delegate tasks, because continuous monitoring and repeated dressing changes may be needed. Finish by preparing the casualty for evacuation. Splint fractures, secure them to a vehicle or carry, and keep the medkit handy for en route care. Once loaded, continue monitoring vitals and repeat treatments as needed. Do not assume one application is final. If the patient's vitals worsen, reassess wounds and restart compressions or tourniquet use immediately. If a medkit action doesn't register, reposition yourself and the casualty slightly. Then reopen the medical interaction menu. This resolves most targeting or line of sight failures.
Thanks for watching. Consider subscribing if we helped you.